Start with the basic of knocking on the door, introducing myself, sanitizing my hand if I get in contact with the patient, and then explaining to the patient exactly what we're going to be doing so that way they are well aware. And the patient that we have on hand is going to be a pregnant woman coming in for advice and of precautions of things to avoid. So I want to teach the patient about foods to avoid during pregnancy, right? So during pregnancy, I would advise the pregnant woman to be mindful of foods such as uncooked food, raw food, soft cheeses, raw or partially cooked eggs, unpasteurized dairy products, deli meats, processed meats, and caffeine intake. So we want to advise the mother to avoid those. The goal is to make sure that the mom and the baby are safe and healthy. So avoiding those things, you avoid any type of complications that may cause any miscarriage or any birth defects. So I would advise the mother to refrain from those things. I know they sound good when we are not pregnant, right? But when you're pregnant, you have to go above and beyond and protect yourself and also protect your baby. So if you have any diet that you're used to, you might want to talk to a dietitian or talk to your healthcare provider so that way you can have a personalized dietary guideline that you can follow during your pregnancy so that way you're safe and that your baby is safe and no complication. But besides just your diet, there are other things that tend to occur, right? We have signs and symptoms during pregnancy. So sometimes we want to use over-the-counter medication. So we want to make sure that is safe for the baby when we're taking over-the-counter medication. So over-the-counter medications such as Tylenol, antacid, and certain allergy medications are considered safe to take by the pregnant woman, but still consult with the doctor. Let the doctor know what you're doing, what you're taking, and to be safe. Some of the medications that are not recommended or told to be avoided are NSAIDs, so non-steroidal anti-inflammatory drugs such as ibuprofen and aspirin. Avoid those, especially during the third trimester of your pregnancy, because they can cause birth defects. So it's strongly advised to avoid those. Some other things to keep taking is your prenatal vitamins that are prescribed by your healthcare provider. Those are always advised to take. Make sure that they're the ones that the doctor does provide to you, and take them as it is ordered. If you do have any medication or supplement that you feel that you may need, always consult with your doctor so your doctor is aware of kind of where your treatment is going, what you're planning to do, so they can give you sound advice, especially with supplements and so forth. So, family members tend to give us recommendation on things to take and things to not take and so forth. Let your doctor know what's going on so they can treat you, and it can be as simple as an email or just a phone call. Another thing for a pregnant woman to be mindful of is your environment, right? Your environment sometimes is hard to kind of avoid, but we don't want to cause any harm or develop any complication during the pregnancy with the baby. So it's strongly recommended that you avoid tobacco use, harmful chemical, or excessive heat. So no hot tubs, that's included in that excessive heat. These exposures can cause preterm births, low birth weight, and developmental issues. We don't want any problems. We don't even want no miscarriages. So avoiding any of these can avoid a lot of complications. So just be mindful of your environment, and then talk to your provider about kind of things that you're not sure of. And you being a mother, you have to create that safe environment for your baby because they're dependent on you. So just be mindful of your environment and so forth. There are a few different products to kind of stay away from as well when you're pregnant, such as alcohol, no drinking, tobacco, try to refrain from it, and substance use. I know this is hard sometimes for a pregnant mom to kind of adhere to, but you have to do your best, right? Because they pose a significant risk to the fetus, because the baby can't do anything; they're relying on you. Tobacco use can lead up to complications such as premature birth, low birth weight, and sudden infant SIDS, sudden infant death syndrome. So you want to avoid that. We don't want to kill the baby. We don't want to harm the baby. We want to protect the baby and you. So refrain from substance use because they can cause birth defects, developmental delays, and neonatal withdrawal syndromes if the mother's on drugs. So avoid that. And you want to prioritize your health and the baby's health. So if you're going through any of these complications in your pregnancy, you can seek professional help to get support, therapy. If you're struggling with addiction or substance use and you want to break that cycle, talk to a professional that can help you. Because at the end of the day, you want to be safe, you want your baby to be safe, you want to have an easy and safe birth, right? So that's another thing to kind of keep in mind. Another thing that sometimes occurs when you're pregnant is we have to get to places, right? You have to get from point A to point B. And to do so, we have to travel. So here are some precautions for when you're traveling, especially around like 14 to 28 weeks. It's okay to travel just because the risk for a miscarriage is reduced during that time. But still keep in mind that if you are traveling around during that time, to let your doctor know so that way they may complete assessment to make sure there's no risk, maybe complete vaccination, give you medications that you might need, because it's very important that you're safe and that your baby is safe. One of the things to watch out for is prolonged period of just sitting down when you're traveling. So if you're going on a long flight, let your doctor know, because we don't want any increased risk of blood clots. So let's say you're on a long flight, you might want to walk, stretch, wear compression socks, stay hydrated, and just kind of move your ankles around, extending it, just moving it around. We don't want you to be sitting in a still position for too long. Same if you're a passenger, you can exercise those same precautions of just moving your limbs so that way they're not in the same spot. We don't want no blood clot to develop during your pregnancy. And always let your provider know that you're traveling and what to watch for and what's going on, and they might want to do vitals and maybe labs just to see where you are. Just safety. Try to be the safest you can be during your pregnancy. Another thing that you're gonna also come with, which is regular, is your dentist, right? So during pregnancy, it's okay to go see your dentist for routine checkups and cleanups and so forth. You might actually see them more than you usually do, because during pregnancy, it's easier to develop like gingivitis, so like plaque buildup, bacteria buildup in your teeth. So you might see them more. But when you're visiting the dentist just for the routine checkups and cleanups, try to inform the dentist that you are pregnant, so that way you can avoid any unnecessary x-rays. You don't want that. And like I said, some of those plaques and bacteria buildup can come from your hormones, so you might see that dentist more than you regularly would. So advising that dentist that, hey, I am pregnant, can I avoid, x-rays? And usually they're mindful of what's going on with you, and they will prevent any complications from occurring. They want to make sure you're safe, your baby's safe, just as much as you're practicing safety with you and your child. So those are just a few things that I'll precaution you when you're pregnant, and that's it. So I would have provided that information to my patient. Once my patient is sound, ask them if they have any questions or concerns. They tell me no. I would then place them in a comfortable position, wash my hands, and then I'll go document.